Welcome, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 429,035 confirmed cases of COVID-19 in Canada and 130,910 cases in Ontario. Chatham-Kent has 536 cases, and Sarnia-Lambton has reported 434 cases. Michigan now has 410,295 cases, with 22,323 cases being in Detroit. Today, we are reporting 127 new cases of COVID-19 in Windsor and Essex County. Of the 127 new cases, 20 are close contacts of confirmed cases. 1 is a local healthcare worker, 3 are community acquired, 1 is an agri-farm worker, and 102 are still being investigated. We have had 4,238 cases since March. 3,597 cases are now resolved, and 556 cases are active and being followed by our health unit. 33 people are currently in the hospital and 9 people are in ICU. We are sad to announce that another member of our community has passed away due to COVID. A young man in his 20s died yesterday. He did not have any underlying conditions. Our community has lost 85 people to COVID. 56 deaths have occurred among residents in long-term care and retirement homes. There are currently 19 active outbreaks in Windsor and Essex County, 6 long-term care and retirement homes, 7 workplaces, 3 schools, 1 community outbreak, and 2 hospitals remain in outbreak. Please do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit close contacts to your household, the people you live with. Keep a 2-meter distance from others. Wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering indoors and outdoors if physical distancing cannot be maintained or if wearing a mask is required. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. Download the COVID exposure app at canada.ca. Testing for COVID is available by appointment at selected pharmacies and assessment centers. Please call in advance to book your appointment and determine your eligibility. Windsor-Essex has 3 testing and assessment centers: Windsor Regional Hospital, Olette Campus, Windsor Regional Hospital Met Campus, and Erie Shores Healthcare in Leamington. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wichu.org for further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. My heart is truly saddened by the news of the 27-year-old male who died due to COVID. I don't even want to imagine how hard it is for a family to lose someone that young, especially someone that young. I truly want to express my condolences to the family, and my thoughts and prayers are with them in this extremely difficult time. We know that the cases in our community is increasing at a rapid rate, and while many individuals will not develop any severe complication, some will and some will die. Our overall case fatality rate in Windsor is roughly around 2.2%, which means that the last 1,000 cases that we have seen in just 25 days, there is a possibility that it may lead to 22 deaths, leaving 22 families devastated. It is up to us to keep not only our own families safe, but everyone else and safe in our community. I request you, I beg you to follow the public health guidelines to bring the case down in our region. The most significant impact we can make is to avoid all non-essential visits and avoid social gathering at all costs. We are approaching holiday season, and everyone must be planning how to spend the holidays this year. While many of you are planning to follow the public health recommendation and stay home and celebrate only with family you live with, but there may be people who live alone and it would be very difficult for them to celebrate alone. For those people, and just for those people who live alone, they may consider getting together with one another family while maintaining the indoor gathering restriction, but also doing their best to follow public health guidance and maintain physical distancing as much as possible and wear a facial covering as much as possible. If you are someone who is at a higher risk of developing medical complications, especially if you contract COVID, for example, seniors and elderly, people who are immunocompromised, please do not visit anyone or let anyone come and visit you. It can be very dangerous for you. On another note, we know some people are planning to travel during the holidays, and I want to remind everyone that borders are closed and is open only for essential travel. But there are people who are slipping through the cracks. Through this YouTube session, I am urging the federal government to immediately shut down the USA-Canada land border in Windsor completely, except for healthcare workers who are crossing to work only and not for anything else, and for the transportation industry that are moving goods across the border. The border should be completely closed for everyone else who is not a healthcare worker or who doesn't work in the transportation industry. And if for any reason, if someone fall through the cracks, upon their return, they must quarantine for 14 days, no exception. Thank you.
We'll now take questions from the media. Today we'll start with Blackburn.
Hi, Dr. Ahmed, a couple of quick questions. First about the latest fatality. You mentioned he has no underlying health conditions. What I have heard is that this individual was caring for family members with the virus. Can you confirm that?
We obviously, as you know, we don't confirm any personal details that could be identifying, so we'll just respect everyone's privacy. The family, if they can share, if they want to share anything, they can. Unfortunately, I would not confirm anything based on the privacy and respect for the family.
Okay. Also, you're urging the federal government to completely shut down the border. We've had some cases from travel. Are those the cases slipping through the cracks that you're talking about, or where are you hearing that some are slipping through the cracks?
Well, we do get travel-related cases, and we have reported it in the last few weeks, especially people coming in travel that are non-healthcare worker and then contracting COVID, either acquired in Michigan and then coming here and then getting tested. But there are a lot of other, information that we get from many sources, which does point out to the fact that people are crossing and are not reporting their travel, and sometimes even these essential workers who may be deemed essential in the U.S., but based on the Canadian definition of essential, they may not be essential. And we need to look into that. And as much as we are seeing the cases increasing everywhere, it is also important for us to do everything that we can to keep our communities safe. We recognize that the Michigan healthcare system depends heavily on the healthcare workers from Windsor-Essex, and we understand that the pressure that we are seeing in our healthcare system, they are seeing similar pressure in their healthcare system as well. So we get that part, and so if they are crossing for work reason, completely get it. But for everyone else, there should be a hard stop if they are not a healthcare worker, if they do not work in the transportation industry.
Final question, in the UK, of course, we know that yesterday, the first vaccines were rolled out to healthcare workers who have a susceptibility to allergies, I guess suffered an allergic reaction. Sounds like it was pretty mild, but the regulatory body there has recommended that those with allergies maybe hold off on the Pfizer shot. What is your reaction? What do you say?
Well, I think with any vaccine, there are some of these minor reactions. Sometimes it's the injection site pain. Sometimes there's rashes. Sometimes there's a mild fever and fatigue that people experience, which is pretty common with many of the vaccine. But rest assured that these mild reaction never turned out to be anything significant. If there is any significant reaction or adverse event related to vaccine, those vaccines, we have a system in Canada that takes it all the way up to the chain, all the way up to the federal government to pool the national data and to identify any trend and concern. Any trend or concern that is identified, then it is reported as such, and appropriate precautions are put in place to protect everyone from those adverse events. So we are looking forward for that guidance from Health Canada once these vaccines are formally approved in Canada, and what kind of requirements or what kind of criteria that they want to set for vaccinating, especially if with someone who either have some kind of an allergies, pre-existing allergies or pre-existing health condition that may put them at I guess at a priority or maybe not a priority for the vaccination. So we'll wait for that guidance from Health Canada.
Thank you very much.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. I've got to say, I've never heard either of you sound so serious before in what has been a very serious pandemic. So can you expand on your feelings about this young man's death in particular, and why it seems to be giving you guys the reaction that it is?
Well, I'll start. And this announcement of this death is difficult. I have a daughter that's the exact same age, and it's the messaging that we say every day. I feel like a broken record, and it's heartbreaking. I can't imagine what the family's going through, and it's just the pandemic continues to, take lives. This past week, every day I'm announcing a new death, and it doesn't matter how old you are, but I don't know. I don't have any words to actually capture how I really feel.
Doctor, is there anything that you'd like to add to what Teresa said about that?
No, I don't, and Teresa's right. Every death that we report, it is a burden on us too, just to even see, because we are getting that information firsthand, and as difficult as it is for us, I don't even want to imagine how difficult it is for the families who are going through it. And especially when to hear when people think that it's not a big deal, and that God forbid if something happens to them or to their families, and I do feel that along those lines sometimes the message is lost. Everything that we are doing, our health unit is doing, our healthcare workers are doing, it will all go into waste if we are not taking any of these things seriously. And if we continue to be irresponsible in our decisions, in everything we're doing, that's basically means that all our efforts that we are struggling right now, we talked about the burden on the entire healthcare system, 127 cases for our region, that small. And the follow-up that we need to do, our team is exhausted. There is no relief for them, even though we got some support. But 127 cases, this is a record that we have never achieved. Even with the largest farm outbreak, we reported 180 cases or 180 something cases in 2 days. And in 1 day, it never exceeded 100 cases. So we have already exceeded that. And these are the cases that are spread everywhere. That means it's not a localized problem. It's a pretty much generalized problem. And we need to fix it, and I cannot fix it. No one can fix it except all of us. Like, unless all of us do our part and just take all these matters seriously, we can't move past that. And as I reported, even just by the numbers that we have, if you have 1,000 cases, in theory, we can expect 22 deaths. That means 22 families. And I can't even imagine that how these 22 families will cope with losing their loved ones.
Okay, thank you both. I know that was a difficult question to answer.
Any questions from AM 800?
Dr. I'm just looking for clarification. So today is a record with the 127. What was our previous highest single day total?
I want to say it was 92 or 93. That was back in July with the farm outbreak that we reported, and that was the maximum that we reported. I can send you the exact number, Rob, after this call. And when I say Mike will send it to you.
I asked you this question a couple weeks back when the numbers started rising, but when you saw 127, I'm guessing earlier today or last night, and I know the death is obviously, like we just all said, very sad, but with the cases, 127, when you saw that number last night, this morning, what was going through your head?
My initial reaction, and I'll just be honest and blunt, I said to Teresa, let's just close our office and go home. There's nothing we can do. It seems like it's just nonstop. And it doesn't matter whatever we are trying to support. We talked about enforcement. We talked about proactive education. We are doing everything from our end to work with the Ministry of Labor, work with the bylaws, work with the enforcement, work with the school boards, work with the hospitals, work with the healthcare partners to provide our support in the best possible way. But it all boils down to us as individuals. What are we doing and how are we protecting ourselves? And I've been saying this, and maybe, I don't know if people don't get it. I would want to assume every person that I am meeting right now could be a COVID positive person. What am I doing to protect myself, protect my own family? And if I cannot see that, I am honestly, I don't have any words to say. This has been 8, 9 months, 10 months that we have been in this pandemic so far. And unless we see the risk and the threat as it is, there's no way that anyone can do to protect us or to bring us back to the levels where we were before. It is us, individuals, every one of us, each one of us. And I really hope that people take that message seriously and do their part individually without even expecting others to do anything. If everyone of us are willing to take that responsibility, I'm sure that our case counts will go down significantly.
Do you think with the man dying in his 20s, the deaths that we've seen in Windsor-Essex for the most part, and correct me if I'm wrong here, have been seniors, do you think this death, and I hate to ask this, but do you think it'll be a wake-up call for the younger generation to say, hey, I could pass away from this?
It should be, and I think they have to recognize that this is a new disease. We don't know what this disease can or cannot do. We still don't have all the answers. There are people who apparently seems okay, and then suddenly they crash. We don't know why, what happens to them. We know that there are some individuals who contract the disease and immediately get worse and immediately died. We don't know what the long-term implications for those who have suffered more complications or are hospitalized for a longer period of time as a result of COVID. We don't know what kind of long-term implication that may have. So as we are still learning a lot about these viruses, I think no one should be in any doubt or mistake that this is a benign disease and it would not lead to people dying or leading to severe complications, I just want to tell them that this is not true. People are dying and people will die. As bad as it sounds, but I am telling you, people will die. Death and hospitalization is a lagging indicator, and we are already seeing that whatever cases that we have seen, it's now showing its course in the hospital and people dying. There was a long period of time when we did not report any death because our cases were low, but our cases are going up and we are starting to report more deaths, and we will continue to report more deaths unless we bring those case counts back to where it is. So it does not differentiate between the young and elderly. Yes, by statistics, you can say that the elderly people are more at risk, but everyone is at risk, and anyone and everyone can develop any severe complications. And as I said, maybe the 20 people in the 20s, they don't feel the pain, but ask your parents, ask your grandparents what they feel if they lose their son or their daughter in that age, how difficult it can be.
Thank you.
Any questions from CTV?
Yes, good morning. I guess aside from lockdown, how else can we get this under control?
So we are looking carefully about that part, and we really are looking for all the options right now. And I am working on some of the additional letter of instructions, or maybe even considering a class action Section 22 order, and it will come on Friday, depending on what happens with our region and what we learn from looking at all these cases and their origin. So stay tuned. Friday there will be more restriction that we will be putting in place, even if the province doesn't put any restrictions on us. We will be looking forward to put additional restrictions locally.
So can you give any other details what would be in this class action, or are you just going to reveal those on Friday?
We'll probably reveal those on Friday. There are a number of issues that we are trying to address, and unless it's finalized, I don't want to share that, but by Friday we will share some of those details.
Okay, thank you.
Any questions from CBC?
Yes, good morning. I also just want to say thank you to both of you for being so open about how you're feeling, because this is all very clearly very painful. I do just want to confirm about the young man who died. This is the youngest death in our region, correct?
Well, we had a man in the 20s died in the past, but and again, I don't want to undermine that impact. That was a temporary foreign worker. This is a person who lives in the community, and so I think even just from the association perspective, that that there may be more attachment locally with this person compared to a temporary foreign worker who came here to work. But the one death that we reported back in that time was the man in 20s, and this is the second one that we are reporting, the man in 20s.
Okay, thank you. I want to ask about the border shutdown that you're calling for. What kinds of conversations have you already had with federal officials about this, and have you received any kind of response on whether that's a realistic approach?
Well, I think we have had a number of conversations with respect to borders and what our concerns are from the federal government. Obviously, there are a number of issues that they have to deal with, and again, I don't want to speak for them, but from the bottom line from us is, as much as we have never gone to the extreme of calling it for complete closure for everyone, and we have always said that we recognize that there are a lot of people who work in Michigan and live in Windsor, and they cross border pretty regularly. Back in the days, I think in the first wave, a lot of them were working from home, and over the course of this pandemic, Michigan opened up, and there were more businesses, more services that are open that in U.S. definition, they are considered essential. And what we have said locally is anyone who's daily commuting for work for essential reason, they are not subjected to the Quarantine Act as defined by the federal government. But what we are noticing is that not everyone who's crossing the border should be crossing the border, that there are other ways, and not having that clarity or the same definition in both sides of the border, it leads to confusion, and expecting that people will cross the border either for that reason or for vacation or for any other reason. So we just wanted to give out a clear message that this is not acceptable. We don't want to see more cases or more people traveling. We have had lots of systems in place in Ontario, even the guidance that if you are in a area of higher transmission, you should not travel to an area of lower transmission, or vice versa. And for the same reason, if we just look at that analogy, the transmission rate in Detroit in Michigan is 4 to 5 times higher than what we have here in Windsor-Essex. So even though, yes, our case rates are high, it's not the same. And also, going back to the same message, what we are saying locally, do not leave home unless for essential reason. If that's the message, that message goes the same way for the border. And if anyone choose to do that, and if they fall through the cracks, we don't want them to be coming back and using the same excuse to say that they are essential workers or they had to travel for work. No, if you're traveling, you are basically quarantining, and I like to see those quarantine orders issued. And if they're not following their quarantine orders, we need to know. We are putting a lot of effort in enforcing everything that we are doing. We work with the Ministry of Labor, we work with our local bylaw enforcement, we work with our police. We really want to give out a clear message about the enforcement piece, and we feel that we have done it well in locally with all our partners. We also need to do a better job in our borders and making sure that with the upcoming holiday season, we keep it only for healthcare workers and for the transportation industry and no one else.
Thank you. And I do just want to ask about the possibility of lockdown again. I know that you said that regardless of what the province decides on Friday, that you'll be issuing your own restrictions. But at this moment in time, what conversations are you having with the province in terms of whether or not we need to go into lockdown?
Well, we do provide them with more details in terms of the cases, where these cases are coming from, what the area of concern is, what the area of focus is, what's the distribution with the congregate setting versus the community, and our ability to follow up with those cases, and the healthcare system ability to deal with what we are seeing here locally. So all of those details, it goes back to the province every day, and they look at it, they have some questions, we answer those questions. So those conversations have been going on for almost 2 weeks now, and we will continue to share that information, and we'll answer any questions and our thoughts in terms of what it should look like for Windsor-Essex moving forward.
All right, just one more question. Just from your perspective, do you think that a lockdown is the next appropriate step?
Well, I think we really have to look at everything, and including the impacts and the benefit that we may get from putting us in lockdown. What are the additional gains that we are getting? Where are the areas of focus? And as we said many times, that the one of the key areas that we are still struggling is individuals and their behaviors and the social gathering that they're having. And how do we get that part in control? And that's very difficult to control as well, unless people voluntarily cooperate and support. So that's the key area. How would that impact if we go into lockdown? So we have to look into that. And the province obviously wants to find that balance between looking into it and ensuring that, you know, if we are moving in that direction, how much benefit it will get and what kind of negative consequences we may see. So it will be a tough decision for everyone, I'm sure, but we will continue to work with them and to figure out the best way to keep our community safe.
Okay, thank you so much.
Any further questions from Blackburn?
I'm good, thank you.
Windsor Star?
Yes, Doctor, in terms of the implementation of further restrictions, what we've typically seen is they're announced on a Friday and put into effect on midnight on the next Monday. Should people have, in this case, the weekend to prepare for enhanced restrictions, or are you thinking something different? Or would they become in effect earlier than the next coming Monday?
Well, we'll have to look at what restrictions or what orders we can finalize, and then recognizing that you know, it's not just a switch that we can flip and everyone will just start to follow. If some of these measures we are talking about can be implemented immediately, we will be looking forward for that immediate implementation. If some of these measures would require some preparation for either on the part of the businesses or in individuals, we will be giving them ample time to implement that. But I think by now we should all know what are some of those things, what are the areas that we are struggling with right now personally, as well as even in any kind of business setting. We should know our shortcomings and we should know how to plug that hole. And once we issue those instructions or orders, people shouldn't be surprised. They should know that, yeah, this is something that we were anticipating, and I really hope that we will be in a position to implement that as soon as possible to get everything under control. Because otherwise, as I mentioned, definitely don't want to see our healthcare system completely get blown away by the number of cases that we are seeing, and also, you know, people developing any complications or even dying.
Okay, thank you.
Any further questions from AM 800?
Dr. Ahmed or Teresa, I'm not sure if you can answer this, but of the 127 cases today, can you give us a breakdown of the ages? For example, is there 20 in the 20 age range, 40 in the 40 age range? Anything like that you can share with us?
Not today, because I think we didn't even get a chance to do a good review on what these cases are, when I'm sure there is an ability to do it, but obviously it was not in our priority. Rest assured, Friday, when I will provide the breakdown, you will see the last 2 weeks data as we have always reported, and I can try to be specific about just today what we have seen, and I can see if our EPI can pull that data, but at this point I don't have that detail.
Okay, one quick one here for Teresa. Teresa, the man that passed away, I'm guessing he was in hospital. Any idea when he was first diagnosed with COVID and how long he was in hospital for?
I don't know all of the details, but yeah, I don't know all of the details, but he had been in hospital. Yeah, maybe Dr. Ahmed knows.
I appreciate it. Thank you very much.
So Rob, this is Wajid. So the person was admitted on December the 4th, and then I guess passed away yesterday.
Okay, thank you very much.
Any further questions from CTV?
No, thank you. I'm good.
CBC?
No, thank you.
Thank you, everyone.